Hi, my name is Kamaljeet Kaur. I'm a student nurse practitioner at United States University. Today I'm going to make an examination video for HEENT. For this video, I'm making this with my son Gunur Singh. He's 14 years old and I'm giving my consents to make this video and upload on YouTube under unlisted title. I'm gonna make this video and upload on YouTube under unlisted title so my professor can see this video and she can grade me for my work. And now I'm gonna start making this video, and I've already washed my hand, but before starting this video I'm gonna again sanitize my hands. Okay, so now I'm gonna start my HEENT video. For this one, I'm gonna start first of all with the head. And for the head, I'm gonna start assessing his hair distribution and the texture. And for the hair distribution, his hairs are equally distribution. I did not see any baldness, any dandruff, or anything, and his hairs are soft and silky, and I did not see any dandruff in his hairs. And for now I'm gonna assess for any lesions, any trauma to his head, or any any scars. Any scars. So I did not see any scars, any trauma. I'm gonna palpate for any limbs or any lesions, any cysts right now. So I did not see any lesions, any scars, or any hematomas or any depressions. So with this one, it has concluded my head assessments. So now I'm going to move forward with my next assessment, which is eyes. For eyes, first I'm gonna start with visual acuity, and for with visual acuity, I'm using this pocket Snellen chart. For this one, we are using this for like 6 feet, but I cannot go away 6 feet because I cannot go out of the frame for this video purposes. And I'm gonna stay close to my patient and I'm gonna check the visual acuity. And but if you are in a clinical setting, they can use the wall Snellen chart, which is like about 20 feet. They ask the patient to read the things from 20 feet, and then they assess the visual acuity of the patient. So I'm going to ask the patient to read these things from like close, so we can check the visual acuity. So I can use this pocket Snellen chart. Okay, Gary, can you please read this third line?
OLCF EFTZ0. Oh.
Okay. Can you please cover your one eye, your left eye?
FPH.
Okay.
OLCF.
Okay. Can you uncover this left eye and can you cover your right eye now? Okay.
FPH. OLCF.
Okay. 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 Can you just okay? So in this case, my client's visual acuity is 20 by 20, which is normal. So if my client can read from 40 feet, so then visual acuity would be 20 by 40, but he can read from 20 by 20. So it means his visual acuity is 20 by 20. So now I've done with the Snellen chart. Now I am moving forward with eye examination, journal inspection. So I'm gonna look at the symmetry of the eyes. They look same. Now I'm gonna check for any bulging of the eyes or any drooping of the eyes. I'm gonna check the sclera of the both eyes. I'm gonna check the eyelids of eye, the upper eyelids, the lower eyelids. The sclera is white. I'm gonna check the conjunctiva. They are okay. And I'm gonna check for the lacrimal ducts. I'm gonna press the lacrimal ducts, and I'm gonna check like if there is any discharge after pressing the lacrimal ducts, but I did not see any discharge, and the cornea is okay, the iris is okay. I did not find any abnormality in the eyes. And now I'm gonna check for the pupils. For pupil, I'm gonna check with the direct light and and with the indirect light for consensually. For this one, I'm gonna use the pen light, and I'm gonna place the direct light into his pupils, so I can check for the constriction and dilation with directly or consensually. First, I'm gonna check the pupils for direct light. Gary, I'm gonna put light into your eyes, okay? So don't move your eyes, just I'm gonna put like direct light into your eyes, okay? So first I'm gonna check the direct light. So I'm gonna put the light first in his left eye. Okay, so pupil is reacting, it's constricting with the direct light. Now I'm checking the right eye. Okay, it's reacting as well, which is normal. Now I'm checking the indirect, which is consensually. So I'm putting the light in the right eye, but I'm gonna look the reaction in the left eye. I'm gonna repeat the process. Now I'm gonna put the light in the left eye and I'm gonna look at the right eye. Okay, it's reacting normally. Oh, you can have a tissue. So it means which is like pretty normal. So now I have done with my journal inspection. Now I'm moving forward with extraocular motions. In this one, I'm going to check for 3 cranial nerves, which is oculomotor, which is cranial nerve 3, trochlear cranial nerve 4, abducens, which is cranial nerve uh, uh, 6. So I'm gonna ask my client to follow the finger, follow my finger directions, so we can see his eye movements and we can check for these 3 cranial nerves. Gary, you're gonna follow the directions for my finger, okay? So I can check your eye movements. Okay. Can you please look at the lateral side? This is cranial nerve 6, upward, cranial nerve 3, downwards, cranial nerve 3. Now I'm going to repeat to the same side, other side, cranial nerve 6, cranial nerve 3, cranial nerve 3, medial side, cranial nerve 4. Okay, when I was doing that, did you see anything double? Okay, so it means diplopia is negative. I did not see any nystagmus. If the eyes is doing any movements like more than 5 times, which is abnormal, so nystagmus is negative as well. And I did not notice any diplopia or any nystagmus. So now I'm moving forward to conversions. So I'm gonna use my pen light. So Gary, I'm gonna bring this close to your nose and you're gonna just focus on this pen, okay? I'm gonna check your pupils, okay? So I'm gonna check for conversions. Okay, so by doing this, his pupils are meeting together into like medially. So it means which is normal. So if the pupils are not meeting together, it means this is not normal thing for the eye inspection. If the pupils are meeting together, it is normal for conversion. So now I'm checking for accommodation. Gary, I'm gonna just like put this pen in front of your eyes. You're gonna focus here. When I'm gonna ask you to focus here, and when I'm gonna ask you to look at the wall, then you're gonna look at the wall. Okay? Can you focus on the pen? Now, can you focus on the wall? Look at the wall. Pen. Look back at the wall. Now at the pen. Okay. So like when his eyes was focusing on the pen, his ciliary muscles was focusing on the pen and it was constricting. And when he was focusing on the wall, his ciliary muscles was dilating, which is normal. So he which is like normal for accommodation. So he is normal for conversions and he's normal for accommodation as well. So I'm done with my extraocular motions. Now I'm moving forward to my ophthalmoscopic examination. And now I'm using my ophthalmoscope to check his eyes from internally. Now I'm using my ophthalmoscope. First, I'm going to adjust the lens so I can properly visualize his eyes, or I can check the cornea lens properly from inside, or I can visualize the cup and disc, or I can just see the blood vessels from inside, how they look like, if there is any problems going on. or like if you are in a clinical setting, we can also dim the light for proper visualization, so we can properly see the red reflex. But for this video purpose, I cannot dim the lights because I need to show my professor that I'm doing the examination. So first I'm gonna adjust the lens so I can properly see. Okay, so now I'm gonna look at the eyes. First I'm gonna look for the red reflex from 45-degree angle. I'm gonna look at the red reflex. Gary, I'm gonna put the light inside your eye, okay? Just open your eye. Okay, now I've seen the red reflex. Now I'm gonna place my hand on the head of the patient, and I'm gonna just lift the eyelid, and I'm gonna just go close to the patient so I can just see the cup and disc. Now I'm able to see the cup and disc. Disc is sharp. I can see the blood vessels. They are okay. I did not see any signs of glaucoma. Okay. The blood vessels look okay. They are there is no signs of hemorrhage. The cup to disc ratio is 1:3, which is pretty normal. So I'm gonna repeat the same process into the another eye. Gary, I'm gonna do the another do it on the another side. So this is, so just always keep in mind, when you are doing the examination on the right eye, you need to keep the ophthalmoscope in the right hand. When you are doing you need to stand on the right side, and when you are doing the examination on the left eye, you need to stand on the left side, and you need to keep that in your left hand for the proper visualization, or we need to keep that in mind so we don't need to harm the patient. So now I'm going to perform the examination on the left side of the patient. I see the red reflex. Now I'm moving closer to my patient. Now I'm seeing the disc and the cup. The disc is sharp. The blood vessels are okay. The cornea is okay. I did not see any signs of hemorrhage. The cup to disc ratio is 1:3, which is pretty normal. So the ophthalmoscopic examination is done. So the eyes are pretty normal. There is no abnormal thing. I did not find any abnormalities in my ophthalmoscopic examination. Thank you. So with this one, I'm moving forward. So I have done my eye examination. Now I'm moving forward to nose. So first I'm gonna look at the nose, and I'm gonna see for the symmetry of the nose if there is any visual problems with the nose. The nose look okay. The septum look okay. The septum is medial. There is no deviated septum. There is no deviated septum noted. No scars on the nose. No lesions found. And now I'm gonna check the mucosa and turbinates of the nose, and I'm gonna use my otoscope, and I'm gonna use the light of my otoscope. And before that, I'm gonna check for the sinuses, and I will check the maxillary sinuses and the frontal sinuses. For maxillary sinuses, I'm gonna place my fingers near to the maxillary bones. They look normal. I did not find any problems with the sinus. Did you ever have any problems with the sinuses?
No.
Okay. So now I'm gonna use my otoscope. So I'm gonna check the turbinates. Okay, now I'm going to inspect with the light the turbinates and the mucosa of the nose. So I'm gonna place my hand on the forehead, and I'm gonna just raise the head a little bit, and I'm gonna just like visualize the nose. So the mucosa is pink and moist. He has little hairs present, which is pretty normal. Both nares are open. So there is no problem I found. So it looks pretty normal. I did not find any abnormalities. And now I'm gonna check the airflow in both nostrils. I'm gonna ask the patient to close one nostrils so I can check the airflow. Gary, can you please just close one of your nose and then breathe with the other one? Take a deep breath. Okay, now repeat with the other one. Okay, so he's breathing properly. Okay, thank you. He's breathing properly. He's like having the equal airflow with both nostrils. He's doing perfectly okay. Now I'm gonna check the smell ability from both nostrils. Gary, can you just please close your eyes? I'm gonna give you two substances. You don't need to cover like this. You can just like close your eyes. I'm gonna give you two products, and you're just gonna smell them, and you're just gonna tell me what it is. Okay? I'm gonna give you the first thing. Can you please smell? What's this?
Pepper.
Okay. So he said pepper, which is right. Thank you. Just keep your eyes closed. What's this?
Coffee.
Okay. Thank you. He said coffee. You okay? Now you can open your eyes. Do you want the tissue? Thank you. And so it means his smell is okay, his nose is okay. I did not find any problems with his nose. So this concludes my examination with the nose. Now I'm moving forward to my next examination, which is for ears. So for ears, I'm gonna check for first gross hearing test for auditory acuity. And for this one, I'm gonna use the whisper test, and I'm gonna whisper some words next to his ears, and if he's gonna tell me the same words, it means he does not have any hearing problem. His hearing is intact. So I'm gonna whisper some words next to his ears. I'm gonna whisper like each like one word into his each ear. So I'm gonna whisper one word into his right ear first. Okay, Gary, you need to tell me what I have told you.
Apple.
Okay, thank you.
Mango.
Okay, thank you. So he has told me the right word, so it means his hearing is okay. He does not have any problems with the hearing. Now I'm gonna do the Weber test or Rene test. For Weber and Rene test, I'm gonna use the tuning fork. I'm gonna produce a sound in the tuning fork for Weber test, and I'm gonna place that on his forehead. If he'll be able to hear the sound equal sound in his both ears, it means his hearing is intact and he can hear well. So I'm gonna do the Weber test first, and I'm gonna produce a sound in the tuning fork first. So this is the Weber test. Can you hear in both ears?
Yes.
Okay, so he can hear in the both ears equally, so it means it's okay. He does not have any hearing problems. And now I'm gonna do a Rene test, which is bone to air to bone conduction test, and air conduction need to be more than bone conduction. So I'm gonna produce again sound in the tuning fork, and then I'm gonna place this tuning fork on the mastoid process behind his ear, and then I'm gonna when it's gonna stop hearing on the bone, then I'm gonna put the tuning fork in front of his ear, and then we can ask him like if he's when he can stop hearing the sound in front of his ear, so then we can assess. Okay, Gary, I'm gonna place on the bone. Okay. Are you hearing that?
Yes.
When you stop hearing, just let me know. Awesome.
Stop.
Okay, now
Stop.
okay. Now I'm gonna repeat this test to the another ear. You hear?
Nope. I don't hear nothing. Never mind, I can still hear it.
Okay, so we have performed the Rene test as well. So it needs to be bone air conduction needs to be more than bone conduction, which is positive. Like he does not have any hearing problems. His hearing is intact. And now I'm going to check his ears, external ears, for any discharge. So I'm gonna just palpate his ears to look for any ear drainage or any lumps or any lesions. I'm gonna press his tragus, and I'm just gonna palpate for any lesions. I'm gonna just uh, push his ear backward and pull upward, and I'm gonna just press from the tragus. I did not notice anything outside his ears, and his ears look okay from outside. But now I'm gonna do my oroscopic examination, and I'm gonna look at the internal structure of his ear if he has any problems with the internal structures of the ear. For this one, I'm gonna use my otoscope to look at the internal structures of the ear. I'm gonna change the cap of the otoscope because I have used this to see at his nose. Now I'm gonna discard this one, and I'm gonna put a new one on. Okay, and for this one I'm gonna use at the external canal first. So I'm gonna put the light on, and I'm gonna hold the ear pinna, and I'm gonna just look at his right ear first, and I'm gonna look at the ear canal, and then I will look at, also visualize the tympanic membrane, and I will assess for the cone of light and also landmark of the cone of light. And I will make sure the instrument safety as well, that when I'll checking the ear canal, I will not damage any tympanic membrane, or I will not hurt the patient. So now I'm going to look at the ear canal. Okay, so I can look at the ear canal. The tympanic membrane is floating free, but it's look little red. Patient has little wax. The cone of light is at 5 o'clock. And I have noted a little redness in the pain. Do you have any pain?
A little bit, yeah.
Okay, the patient have little pain in the right ear. The little tiny hairs are present. Okay, so for the right ear, the canal is clear, and it's little, the tympanic membrane is little red, and can you please put your hands down? And the cone of light is at the angle of 5 o'clock in the right ear, and it is little red, and patient has little pain in the right ear as well. So I'm gonna look at the same I'm gonna look at the ear canal at the left ear as well. So now I'm going to do the assessment on the left ear as well. I'm gonna hold the ear, and I'm gonna keep in mind the safety as well, the instrument safety as well. Okay, the ear canal is clear. The tympanic membrane lies, it's floating free, but it's smooth. It's pearly gray. The cone of light is at 7 o'clock angle. At 7 o'clock angle, and there is no infection in this ear, but the right ear is look a little red in comparison with the left ear. With this one, I have finished with my ear examination, and then now I'm moving forward to mouth, throat, and face. So for mouth, I'm gonna assess for the lips first. So the lips is look pink and moist. I did not see any cracks or any lesions on the side of the lips. It looks okay. And now I'm gonna assess for the buccal mucosa, and I'm gonna ask the patient to open his mouth so I can look for the internal organs, his teeth, his gums. I can look for any gingivitis, his any infections, any caries. I also want to look at the strength of his tongue. I want to visualize the papillas, the uvula, and I want to look at the glossopharyngeal nerves, the vagus nerve, and I also want to I will look at the tonsils or pharynx as well. So I will ask my patient to open his mouth. Gary, can you please can you please lift your tongue out? Lift your tongue out. Okay. Okay. Okay, the buccal cavity looks okay, pink and moist. The tongue is pink and moist. I did not see any white patches on the tongue. And can you please say ah?
Ah.
Okay, I can see the uvula. It's lying properly, and I have seen the papillae. It's about 1 to 2 mm in size. And Gary, can you please open your tongue again? Okay. Okay, can you close your? So he does not have any caries. Can you just see? Okay, he has like his teeth look little asymmetric, and he has little chip tooth in the front. And Gary, can you please just take your tongue on the side and touch your cheek? And the other one. So in this way, I am checking the strength of his tongue. Okay, that's fine. And the soft palate is okay, and it's appropriate. The uvula is okay. And I did not notice any signs of infection. There is no foul smell coming from his mouth. And so his teeth are okay. There is no gum issues going on. The tonsils appear normal. They are not swollen. They look okay. And there is no teeth missing, but he has just a little chip tooth. And with this one, I think I have finished with my oral cavity performance. Now I can move with my next examination, which is for the neck. I think I have covered. Gary, can you please do the now I'm checking for the neck, and I'm gonna check for range of motions. Can you please flex your neck? Do you feel any pain? Okay, can you please do the hyperextension like this all the way back? And now can you just please rotate your neck like this? Okay, can you please come in the frame? Okay, did you feel any pain?
No.
Okay, now I'm gonna check for the Okay, he has did the lateral rotation. Did you feel any pain?
No.
Okay, now I'm gonna check for the shrug of the shoulders, and I'm gonna also check for the symmetry of the spinal cord accessories. I'm gonna place my hands on his shoulders. Can you please raise your shoulders again, the resistance? Just raise your shoulders like this. Did you feel any pain? Okay, so and his spine look okay, there is no problem in his spine, shoulders look okay. And now I'm gonna check the strength in his neck. I'm gonna place my hand on his right side of his neck, and I'm gonna ask him to just push against the resistance of my hand so I can check the strength in his neck. Can you just push against resistance? Okay, that's it. Can you push on the other side? Okay, so he does not have any problems with the strength. It's okay. And so when he was turning his head, there is no problems. And now I'm gonna start assessing or palpating for the lymph nodes. And I'm gonna assess for first periauricular lymph nodes, and I'm gonna put my fingers on the periauricular places. There's no lymph nodes. Now I'm gonna assess for the post auricular lymph nodes. Okay, now I'm gonna ask for submandibular lymph nodes. Now I'm gonna assess for submental lymph nodes. Now I'm gonna assess for subclavicular lymph nodes. I did not feel any. Then I'm gonna assess for subclavicular lymph nodes. Then I'm gonna assess for occipital lymph nodes. Then I'm gonna ask for subclavicular lymph nodes. Then I'm gonna look for his trachea. So Gary, can you please swallow? So trachea is midline. I did not notice any deviation in his trachea. With this one, I have finished with my neck examination, and now I'm going to assess for thyroid examination. For thyroid examination, we can also visualize the thyroid with the swallowing, or we can also palpate with our fingertips. Or there is another trick to look for thyroid gland. We can ask the patient to move his neck to one side. Like if we are asking the patient to move his neck to one side, we can see a swelling here, and we can like visualize if there is any issues going on with the thyroid gland. And now we can just like ask the patient to stay still, and then we can inspect, we can visualize like the thyroid gland. It's like above the trachea. We can just palpate the thyroid gland with our fingers, or we can look for the cricoid gland. We can feel the thyroid gland we can feel the cricoid gland, and we can feel for the thyroid gland. And then like we can ask the patient to swallow. Can you swallow please? Okay, we can feel for the softer parts of the thyroid gland, and if it feels swollen, then it means patient has some problems going on with the thyroid gland. Or we can also ask the patient, can you please, we can also feel from the back of the patient. Can you please just move here? Or we can also do the same process. Can you just like sit here? Just come here. Now just come into the here. Like, okay, so we're gonna feel in the same way. Just we gonna feel the cricoid cartilage above the trachea with the soft fingertips of our fingers, and then like we can feel with one hand, and then we can ask the patient to swallow and push with the other hand. Gary, can you swallow please? Okay, just did you feel any pain? Okay, so in this way with our fingertips we can feel the thyroid gland. If it's like enlarged, we can assess for any thyroid problems. And I did not find any problems with the thyroid gland. It's look healthy. with overall my examination, I did not find any problems in this patient, except the right ear pain. He was having the right ear pain, and I noticed a little redness in his right ear. And I think I have complete most of the things. And with this one, I'm just like wrapping up my examination. And Gary, thank you so much for helping me with this video. And thank you so much, Professor. Thank you.